Hey everyone, Bruce Edmonds Jr. here with Stroke Therapy. As you know, I had a ischemic stroke in 2014, 6 years ago. And from my stroke, I actually had a bad subluxation, which was caused by a seizure. And I had to get a massive operation done on my shoulder to put the humerus fracture back together. But right now, I'm using a device called...
So this is a massage gun. Junior's had some tightness in his pec major. So that's the muscle that connects the shoulder to the trunk. And I'm just using this massage gun, which has different settings on it that allows different vibrations to come through, just to loosen that muscle and relieve some of the tightness there.
Yeah, the pain seems to have dissipated since we've started using this only a few moments ago.
So if there's pain associated with muscle tightness or muscle tension in the shoulder complex, that can be related to pain and stiffness in the neck, which can be related to headache and migraine.
That's what I suffer with that, as you know.
Yeah. So headache and migraine, oftentimes it's multifactorial, which means there's various things that can cause headache and migraine. It could be vascular, which means something to do with the blood supply. It could be musculoskeletal, which has something to do with the muscles and the joints. It could be psychological, which could have to do with stress and tension. So it's important when you're treating headache and migraine that you do a really thorough assessment to see what all the contributing factors are, and that you systematically try and address each of those contributing factors.
Is that what you've learnt with your physiotherapy over these years?
Yes, I'm a neurophysio. A lot of people after neurological conditions and injuries experience headache and migraine. So it's really important to do a thorough assessment, find out what the history of the pain has been, find out what they've tried before, do an examination of anything that could be contributing to that, and try and treat it really holistically, taking all the factors into account.
Now, we're at Vicky Cook Home Therapy at the moment, Vicky Cook Physio. Just one thing, with my shoulder, it's sublux, yeah?
That's right.
And what does that mean exactly when in the terminology of subluxation?
Subluxation is when there's a separation between the joint space that is larger than normal. So if we think about the shoulder joint,
You can have a look at my shoulder.
this is the upper arm bone, which is called the humerus, and this is the shoulder blade, and the end of the shoulder blade is called the glenoid fossa, and it's shaped like a socket, and the top of the arm bone, the humerus, is a ball. So the ball of the humerus should fit in the socket of the scapula of the shoulder blade. Oftentimes with stroke, when you've got weak muscles, the pull of gravity down can't be supported because the muscles are so weak.
So pretty much the shoulder starts to detach from the socket then.
That's right. So you start to see a separation between the shoulder and the shoulder blade. And for some people that doesn't cause any pain at all, but it does cause some deformity or a difference in the look of the posture of the shoulder. But in a lot of people, that subluxation can be a real contributing factor.
See, because when I broke my shoulder, it was very evidence that you can see the subluxation. There was like about an inch between the joint and the humerus.
Yep.
And they did 3 shoulder reconstructions to get it finally back in place. So if I move across to, you can see the scar of my arm. I'm going to explain what they've done.
So they've done a reconstruction of Junior's shoulder. When he fell over, he broke his arm, and so they've opened it up, put some metalwork in there, which is called fixation, and allowed those bones to knit back together again. And unfortunately, Junior still has some weakness in his arm and also some stiffness in his shoulder, and that posture and that tension would be one of the contributing factors to his ongoing issues with headache and migraine and things like that.
And also this caused limitations in moving my shoulder more, right?
That's right. So although Junior has got weakness in his arm, he's also got quite a lot of stiffness in his shoulder. So even if he had really strong shoulder muscles, he would be quite limited in how far he could lift his arm because of the metal work that's in there and also the stiffness of the shoulder joint itself.
But I'm getting a lot more movement from my elbow.
Yeah, so you can see in the elbow, there's full range of movement of bending, which is called flexion. And with a push, we can almost get full range of movement of extension, which is the straightening. But in the shoulder, even with a push, there's a lot of resistance to movement, which is the stiffness in the shoulder itself, and also the internal fixation that was used to help knit the bones back together.
Do you think even if they take out the metal work, it's going to make much of a difference?
I don't think so. I think that there's definitely some adhesions and some contracture, so that's something that's a lot more difficult.
Vicky Cook Physio taking a call now.